How to get rid of a stoop and kyphosis using Cordus. Correction of deep-seated muscles of neck and chest. There are two areas that need to be addressed in case you have developed a stoop. The base of the skull is the key area here, as I mentioned earlier. The back of the neck, or the upper neck, need to be treated here as well. And the thoracic region, the lower neck, the upper back, and the shoulders need to be addressed first and foremost. The Cordus device can be used as an auxiliary tool in our case. It works well on the entire neck area, as well as on lower neck, the upper back, and the shoulders area. Do these exercises first, in order to relax and prepare the area for therapy. For a preliminary treatment of the thoracic region, you should do the cat pose. First, you should round your thoracic region, then you should arch your spine. There is one thing I would like to highlight. When you round your back, the top of your head should face downwards. When you curve your thoracic region, your head should face upwards. Doing so, you will be able to go through the full amplitude range of rounding and arching of your back. You should do the exercise at least 10 times. Further on, try and be able to do it as many as 20 or even 30 times in a session. Round and arch your back as far as you can. Try hard to round the thoracic region of your spine as far out as you can, in order to treat all the thoracic segments. You should breathe out when you round your back and breathe in when you arch it. The snake pose seems a perfect name for the next exercise we are going to show you. That's what it is commonly referred to in yoga practice. The starting position, lie flat on your stomach on a mat, arms stretched out. While taking a deep breath, lift your head and the thoracic region of your spine. Just do it like this. Almost like the way a cobra does it. You can try and increase the rounding and arching amplitudes gradually, while putting an emphasis on the thoracic region, though it may seem that your lumbar region is capable of aching much farther in. This is why your stomach resting on an exercise mat is the criterion for the exercise, as you should only lift up your thoracic region and your head. Please be careful to keep your stomach resting on the mat while doing the exercise. You can also try doing the fixation version of the same exercise. Lift your head and your thoracic region while taking a breath in, then hold that position for 5 to 7 seconds, then lower your head and your body on the mat as you exhale. You should also do the total of 20 to 30 repetitions of this exercise. Now, use Cordus in 3 basic points to treat the cervical and thoracic regions. The upper neck is the starting area for a relaxation and relief session to address stoop issues. Place the C side of the Cordus device so that it fits the base of the skull. Just feel down the back of your head with your fingers to find a couple of soft muscles. This is the area where you should place your Cordus. Then, feel free to lower your head on the device and safely lie down. It is advisable that you rest your arms on your side. Spend the next 2 to 3 minutes lying down, the back of your head resting on the device. The tiny spikes on the C side of the device were designed to provide deeper treatment of neck muscle fibers. This also improves circulation not only in the neck but even also in the brain.
Since you are just starting your therapies, remember that the cervical side has some tips. If you are sensitive, I recommend you put a towel over and you'll feel better. You adjust it and it's ready. Now, if you feel it slips, you can put a little towel on your shoulders.
Finish the thorax treatment and relaxation session using Cordus. To do that, you should place the side D of the device in the upper part of your shoulder blades, then between your shoulder blades. Let me just show you how to do that, and I think Inga will be able to do it herself then. First, you should lift up your thoracic region slightly. Then, apply the side D of the device to the center of your upper back. Then, you should lie down on it. As soon as the device fits above your shoulder blades, you can stretch your arms behind your head, at your convenience, and as far back as you are able to. Chances are you will only be able to spread your arms like this, crosswise. Or, maybe you will really be able to stretch them behind. When you stretch your arms behind, the device goes deeper into the paravertebral muscles, thus providing a better relief and relaxation of the lower neck, shoulder and upper back region.
If you feel some pressure, remember to have your towel with you. And you can put it right here to feel more comfortable.
And, applying the side D of Cordus device directly between your shoulder blades is the final stage of a relaxation session to fight a stoop. Yes, right there. For starters, you can apply the device here. Then, you can adjust its position and then lower your body on it. You can bend your arms and support your body weight on the elbows to be more comfortable. As many tend to strain their shoulders doing so, you should exhale and relax them as deeply as you can as soon as you are down on the device. You would be well advised to rest your head on a low cushion to make the treatment more comfortable.
Okay, now let's move on to the second point of the dorsal zone. We have some books to give you support. And put the books at the level of the hip. If you want more pressure, you can take away one book or all of them. And if you don't want as much pressure, you can put more books. Also remember that if you have scoliosis or too much pressure in your dorsal zone, you can get support from a towel in the shoulder blade zone and the books in the coccyx zone. The device keeps doing its work. Remember to provide support to your body. You can use a small pillow, a towel, or the books.
For more benefits, after 3 therapies, you can add an extra point. This point is located between the shoulder blades, 4 cm above point 4. Finish the therapy with exercises to recover the muscular tone. Do an exercise to stabilize the neck. Lock your fingers together. Place your hands behind your head and gently push your head forward as you exhale, until your chin almost reaches your chest. Remain in this fixed position for 5 to 6 seconds. Then, regain the starting position with your arms on your sides. This exercise stabilizes the neck muscles. which means it restores their normal tone. Plus, cervical vertebrae regain their normal positions due to relaxation. Stabilizing means restoring normal functioning of vertebrae. As soon as you provided necessary relaxation to all the spinal areas, do a simple relaxation and stretch exercise. Lock your fingers and stretch your arms behind your head. And stretch your heels as you exhale. Your heels. And your hands far behind your head with the fingers locked. Alternatively, you can do it like this. Do it twice. You can achieve a good stretch as you count to 5 while exhaling. So, here it goes. Important tips to apply Cordus at home. Use the device in a pleasant and comfortable way.
I recommend you put a towel over, and you'll feel better. You adjust it, and it's ready. And go back to your position. If you feel some pressure, remember to have your towel with you. And you can put it right here to feel more comfortable. We have some books to give you support. And put the books at the level of the hip. Put the device. If you want more pressure, you can take away one book or all of them. And if you don't want as much pressure, you can put more books. You can get support from a towel in the shoulder blade zone and the books in the coccyx zone. And also remember that you have to feel always comfortable. You can use books as a support, as well as a pillow or a small towel. Put a towel in your lumbar zone and gently lift your hip, and then we will put it in the middle of the buttocks. Then you can stretch and well, honestly, the device is so helpful, you can do it seated. It's very easy. Remember, we start with the cervical, the C, and the little arch. We position it, and we relax. After 2 to 4 minutes, depending on how you feel, lower it to to the second point of the cervical, right here. And if you feel the device slips, you can hold it with your fingers, or you can put a towel under the cordus. Adjust it. Your legs aligned with your shoulders, and rest. Remember, you can do it like this, or you can push yourself back like this. Remember, you can put the desired pressure on your back. Position your device. Right now I'm going to put it on the lumbar zone. I rest, and I let all my back fall. If you feel it's too much pressure, get back up towards the front a little. There shouldn't be any kind of pain. You need to be comfortable and enjoying your therapy. Also remember that if you don't wish much pressure, you can use any type of support. This time I chose a cushion. I adjust it with Cordus, and I relax. All right. Now we'll proceed with the dorsal zone. Since it's a bit complicated for you to do it on your own, if you don't have anyone to help you, you can use a towel, attach a spring to it. Remember, it's the dorsal side, so we'll put it on the D side, just like this. Very well. Now we'll put it over here, like this. You position it at the dorsal level, and it's ready. Now you position yourself perfectly well, and you can adjust the towel to the level you want. Remember, it's very important to align your knees to your shoulders. Breathe in, breathe out, and relax. Remember that like this, you can move and adjust the towel to the appropriate level for you and work your spine perfectly well. Now adjust yourself, let it rest, and relax. Remember that in this way, you can work your whole spine. Just remember that once you get to the lumbar zone, we'll lower it and adjust it to the L side. Now adjust yourself, and it's ready.